All right, today we're going to talk about a drug that totally reshaped the world of medicine. I mean, this thing was a blockbuster, a Nobel Prize winner, and honestly, a miracle for millions of people. But it was also hiding a pretty big secret, a secret that would teach doctors one of the most important lessons in modern pharmacology. Let's get into the story of cimetidine. And that's really the big question here, isn't it? We're going to break down how this drug, which was celebrated for its unbelievable success, also became this powerful cautionary tale about the dangers that can be hiding right inside our medications. To really get why cimetidine, or Tagamet as it was known, was such a massive game changer, we have to rewind the clock a bit, to a time before it was even on the shelf. It is kind of hard to imagine now, but before cimetidine came around, if you had a really bad peptic ulcer or just relentless heartburn, your options were not great. We are talking about major invasive surgery on your stomach being a totally common treatment. That was the world cimetidine was about to turn completely upside down. And oh, what a change it was. The science behind it was so revolutionary that in 1988, its developer, Sir James Black, was awarded the Nobel Prize in Medicine for it. This was not just another pill, you see. This was a fundamental shift in how we understood and treated a huge medical problem.
And it was a true powerhouse. It could heal painful stomach ulcers, it gave incredible relief for people with GERD, and it was even used in the ICU to prevent life-threatening stress ulcers in critically ill patients. It absolutely earned its blockbuster status.
So how in the world did this thing work its magic? Well, the science behind it is actually kind of beautiful and really simple. Let's break it down. Okay, so think of your stomach lining kind of like a factory. A chemical messenger called histamine shows up and it acts like a key. It's looking for a very specific lock called an H2 receptor. When that histamine key turns the H2 lock, boom, it sends a signal to turn on the proton pump, which is basically the machine that pumps acid out into your stomach. And here is where cimetidine is so clever. It basically gets to that H2 receptor lock first and just gums it up, blocking the keyhole. So when histamine comes along with its key, it can't get in. There's nowhere for it to bind. The signal to turn on the acid factory never gets sent, and the proton pump just stays quiet. Less signal means less acid. It's as simple as that. And that's exactly where this class of drugs gets its name. Cimetidine was the very first H2 receptor antagonist. It doesn't destroy anything, it just antagonizes the receptor. It gets in the way, it blocks the signal. A totally revolutionary idea at the time. But here's where our story takes a really sharp turn. Because for all its amazing success, as millions and millions of people started taking cimetidine, doctors started to notice some strange and pretty unexpected problems. One of the first big red flags was this weird anti-androgenic effect. It turns out that cimetidine wasn't just good at blocking H2 receptors in the stomach, it could also mess with male hormone receptors in other parts of the body. And this led to some really distressing side effects for men, things like gynecomastia, impotence, and a loss of libido. Now, as troubling as those side effects were, they actually weren't the biggest problem. No, the real danger, the lesson that would change medicine forever, was something way more subtle and way more dangerous. It was all about what cimetidine did to the other drugs a person might be taking at the same time. So to get this, you need to meet a really important system in your body, the cytochrome P450 system. You can just think of this as your liver's main drug processing factory. It's the cleanup crew. When you take just about any medication, this team of enzymes gets to work, breaking it down so your body can clear it out. And here is the absolute crucial point. Cimetidine is a powerful inhibitor of that factory. Taking it is like throwing a giant wrench into the machinery. It slows the whole assembly line way down, basically clogging up your body's ability to process not just cimetidine, but a whole bunch of other drugs too. Which of course leads to the most important question of all. If that factory is all clogged up and it can't clear out other medications like it's supposed to, what happens then? Well, the consequences can be incredibly serious. And the results are just stark. Take warfarin, a really common blood thinner. Cimetidine blocks its breakdown, right? So the warfarin levels can just build up and up to dangerous heights, putting someone at a huge risk for a major bleed. Or what about theophylline for asthma? If the body can't clear it out, it can become toxic, leading to seizures or heart problems. The list just goes on and on. Cimetidine was basically turning safe doses of other essential medicines into potential overdoses. This discovery just fundamentally changed everything for cimetidine. I mean, it still worked, but the risks were now clear as day. And that paved the way for a whole new generation of much safer drugs to take its place.
And when you put them side by side, the choice becomes pretty obvious. You've got cimetidine on one hand, and then these newer drugs like famotidine or the even stronger PPIs on the other. The newer guys offered better, longer-lasting acid control, and they did it without the hormonal side effects. But most importantly, and this is the key, they were designed to have little to no effect on that critical CYP450 system. This made them worlds safer for patients who are on multiple medications.
So, what's the big lesson here? What's the final takeaway? Cimetidine, in its flaws, taught medicine a lesson that was just as valuable as the one from its success. It hammered home the fact that you absolutely cannot look at one drug in a vacuum. It forced doctors and pharmacists to look at a patient's entire medication list, to think not just about what a drug does to the body, but what it does to every other drug that's already in there.
And that really is cimetitine's legacy. It was a true landmark, a breakthrough that eased the suffering of millions and earned a Nobel Prize. But it was also this unforgettable, stark reminder that in medicine, sometimes our greatest teachers are our mistakes. It was the drug that taught us all to look a little deeper, and for that, its place in history is absolutely secure.